For 5 minutes of questions.
Thank you, Mr. Chairman. Thank you for holding this important hearing today and the opportunity to hold former Governor Cuomo accountable for what I consider as egregious actions taken during the coronavirus pandemic, which led to the unnecessary deaths of thousands of American citizens. Mr. Cuomo, what demographic or group of people are at the greatest risk of death from COVID?
Immunocompromised, senior citizens, what we saw at Kirkland Hospital, Seattle,
right.
Washington, as the first experience.
That's right. COVID in particular, it was the elderly and those with comorbidities. The exact population, unfortunately, that occupies every nursing home in this country. Despite that basic medical reality, your administration mandated that nursing homes accept COVID-positive patients, and I've heard you say that they didn't mandate it, but they did. It says here, this is the directive, I have it in my hand. It says, no resident shall be denied readmission or admission to the nursing home solely based on confirmed or suspected diagnosis of COVID-19. So your assertion that the nursing home had the ability to turn these patients away is absolutely incorrect based on this. They did not have the ability to do that. They could not turn them away. By doing this, you sentenced many of the residents there to death because these residents that were in the nursing home that didn't have COVID, that were immunocompromised, that had comorbidities, that were elderly, were destined to get COVID at that particular point when you're bringing known COVID-positive patients into the hospital. Even if you prohibited patients prior to admission, which would have been, you didn't allow them to test them. And that would have been key in deciding who was going to get quarantined and who wasn't going to get quarantined. It says in here that they can't be tested prior to admission. That's crazy. If you're admitting a patient and you can't test them, you don't know what to do with them when you get them. It ignores the fact that they were allowed to go there even if they were known to have COVID. But I submit to you that your claim that the nursing home staff brought this in to the nursing home is completely false. You claim that the nursing home staff was responsible for the deaths, that they brought it into the facilities. Well, perhaps there were instances of that. Maybe there were. But I can promise you that if you are directing patients with known COVID to be admitted, you no longer need to be asking the question of how COVID got into the facility. You introduced it at that point. It does not matter if staff are bringing it in or not. If you're allowing and mandating that COVID-positive patients be admitted to the nursing home, that is how it's getting in the nursing home. That's how it's spreading, and that's how it's killing other residents. Anyone that gave you the advice on this directive should be held accountable right along beside you. Anyone that was participating in that. In particular, Dr. Howard Zucker and Nurse Sally Dreslin, your DOH commissioner and deputy commissioner, should, in my opinion, have their medical license taken away and never have anything to do with the practice of medicine again based on their advice on this letter to you that the three of you are on the top of this letter having endorsed.
Doctor, if I may, it said you cannot solely refuse a person based on the diagnosis, which is the same thing the CMS CDC said.
Who cares if they're diagnosed with COVID? What does it matter? You're saying, well, maybe you can't say it's because they have diabetes.
No,
it has to be.
You can say I can't take care of them. I can't take care of them. A nursing home had total discretion. I didn't have.
So they would have to, if they had a patient that was coming from the hospital that was diagnosed as positive for COVID, and they had no other medical issues, and they were medically stable, which, by the way, has nothing to do with whether they're infectious or not. Then the nursing home could turn them away at that particular point. That's not what the letter says. The letter says that they have to take them.
I know, doctor. The advisory does not supersede the law. The law is very clear. The Attorney General said the law was in place. A nursing home shall only accept people for whom they can provide adequate care as determined by the nursing home. So if the nursing home says, I can't quarantine this person who may have COVID, that's it.
No, but that's not what it says here. It specifically says that if they have COVID and that's all they have, they can't use that as a reason to not admit them. They have to admit them. That's what this letter says.
No, it says you can't solely not admit them because of COVID-19, but you can say, I can't take care of them. I don't have the precautions.
What's the difference? If you can't take care of them, you can't admit them.
That's right, and you don't admit them.
But it says you can't not admit them. You have to admit them. You're saying, oh, but if we can't take care of them, you don't have to admit them. That's not what it says.
CMS CDC says you can accept a COVID positive person if you can take care of them.
That's not what this says.
This says you can't say no just because they have COVID-19, but you can say, I can't take care of them. I have no quarantine.
So
It's
what if they
totally
say,
up to the
I
nursing
can't
home.
take care of them because they have COVID-19? They can't do that, according to
Yes,
this
they
letter.
can.
No, they
Totally.
can't. Look, and I agree with my colleague here, Ms. Green, that you had a perfect opportunity to put many of these patients into a safe environment on the hospital ship that had 1,000 beds, that was left New York after not being used and being used less than 190 times. It could have been there. You could have put them all there, and you could have saved a lot of lives, but you didn't too.
Now recognize,
except the
gentleman's time has
COVID-19 wouldn't
expired.
accept COVID
I now
positive
recognize
people.
Dr. McCormick from Georgia for 5 minutes of questions.
Well, that's the fact.
Thank you, Mr.